Mr. Chair, and thank you, the organizer, for the invitations. My presentation will be on where we are on the hepatitis C infections in sub-Saharan Africa. Oh, sorry. Okay, I will first start by saying that I have nothing to disclose. So, my presentation will first present some challenges, some key challenges that sub-Saharan Africa have in the elimination of HCV infections, some of the progress and efforts, and I will finish by the future direction and best practices that we have to do to move forward. So hepatitis C remains a significant public health challenge in Africa, and sub-Saharan Africa has the high prevalence rate and substantial HCV burden, but detailed epidemiological understanding of the disease burden is absent. Most of the data that we have were focused on sentinel populations, mostly blood donor, pregnant women, and the data on the general population are very scarce. And according to the WHO, globally HCV infects about 80 million of persons, which 40% which are located in sub-Saharan Africa. So the global health sector strategy in 2016 have presented some targets that we have to follow for the elimination of hepatitis C and B in 2013. And the endpoint, the target was 90% reductions for Hep B and C and 65% for in the rate of deaths. So in 2022, please, this target, this WHO GHS have been revised, but the target remains the same. As you will see that even we need to reach the target of 90% for the people living with hepatitis B, we know their status, and 80% of endpoint of treatment. With these two strategies, with these two GHS elimination plans, the strategy to eliminate HCV have three main points. The test and treat, this means that to have a universal HCV screening, the linkage to care, the reductions of the cost of treatment, the prevention mostly on harm reduction, infection control, and blood safety, and finally, regarding the population, the awareness. So what are the key challenges of the elimination of HCV in sub-Saharan Africa? The main challenges are the high prevalence of HCV in Africa, the high co-infection rate with other infectious disease, the limited data, as I said, on the epidemiology in the general populations, and the main transmission routes that are not well understood because we know that Hep C is mostly transmitted by parenteral load, but some specific transmission routes in our setting are not well understood. Low access to diagnostics and treatment, and financial barrier to scale up. I will develop this one by one. Regarding high challenges on the high prevalences, sub-Saharan Africa had a high burden with about 9 million of people infected. But prevalence varies across country, with some area having high prevalences more than 6%. The co-infection also is a challenge, and there is, as I said, the limited data in the general populations. For example, in my country, in 2000 and, okay, these are the other, sorry. The other challenges are main transmission routes that are not well understood because we know that HCV is mainly transmitted through parenteral route, and sexual and mother-to-child transmission are very rare event. It's not the same as hepatitis B. And in sub-Saharan Africa, iatrogenic transmission through medical procedure, intravenous routes, blood transmission are among the main route of transmission. The access to diagnosis and treatment, we know that there have been many rapid diagnosis tests and point of care tests that have been developed, as well as very good direct acting antivirals, but as we said, these are not well available in Africa. And the last but not the least, the financial barrier, because in most of the time, the treatment and the diagnosis are paid out of the pocket of the patient. So what are the progress that Sub-Saharan African have been done? Regarding the awareness, we know that compared to previous years, there have been a growing recognition of the need to address HCV by increasing awareness. Even in my country, there have been studies conducted among healthcare professionals, policymakers, even the population, and most of them are aware about the importance of doing their testing or fighting against hepatitis. Also, there have been national plans available in some, even though it's not in all countries, but most of the countries now have their available by birth. Apart of Egypt, which is not in Sub-Saharan Africa, the good student of this implementation or the development of national plan is Rwanda. And regarding the production of data on in the general populations, some of the countries have done it. I'm presenting you here one of the results of my study that I've done on the general populations. And I take the advantage of the 2011 demographic health survey, and which helped to collect more than 14,000 samples among Cameroonian, the 14 to 49 years, and for both genders, and from 50 to 59 only on men. And the overall prevalence that was found was less than 1%, which was not what was reported with the data on blood donors, pregnant women. And what we observe is that the seroprevalence stratified by age, sex, and rural area shows that there were, let's say, prevalence was less than 1% among people who age less than 45 years, and was increasing with age, and the peak was reached at the people age more than 55 years, with 7% people infected. And also what we found was that there were, let's say, a difference among different regions of Cameroon, because we have 10 regions, and what we observed was that the prevalence was very high in the southern part than in the northern part of Cameroon. This is a meta-analysis and systematic review that was recently published, including some of the study published on the prevalence in the general population of Sub-Saharan Africa. As we observed, according to this study, the overall prevalence was 2% of FC, and the high prevalences, as I had shown in my study, was found among older individuals, was high in rural community, and was so high in Western Africa and some Central African countries. And I think that Cameroon is among those Central African countries. And also the study shows that there were, let's say, a decrease or a decline of HIV prevalence with years. This showed that the implementation of immunization sometimes have an effect, because the seroprevalence in the general population go from 5 and 7% in the 2000 to now 3% in 2023. And as I show, this is the best student regarding the national plan and the implementation of the elimination of HCV. Rwanda was the best with all the data that is shown, and even cost what will be done to the fight to eliminate hepatitis in the country. So the progress also have been done in the screening and diagnostic awareness, advancement place, because simplified algorithm is using only RDTs, and point of care tools are now used on the field in most African countries, because as we said during the previous panel discussions, the availability of the access to more complicated diagnostic tests are not possible in the remote area, and even in some urban area, central laboratories, and the use of this simplified algorithm have already helped in more African countries to test more people. Also, as I already said, the treatment advancement, because in most of the country, the generic are used. And the best thing is, I think that the Africa CDC and WHO have represented the effort for the regional collaborations, which now helps even those who are not going very quickly to learn from the other experience and going very quick. And the integration also was a success. This is one of our studies where we show that the integration of the testing and treatment was feasible in Cameroon or in most sub-Saharan African countries. But as we said, it's not the feasibility, it's only the feasibility study that have already been conducted. The scaling up is not yet possible. And also, when you see this 2014 report from WHO, you see that going from the baseline of 2020, there have been many progress done, even if there is only a last progress, but this means that effort have to continue. So what are the future directions? The future direction will be, first of all, to strengthen data collection, because we know that if we do not have a comprehensive and reliable data on prevalence, risk factor, treatment outcome, it will not be possible to plan and monitor what we are doing in the country. So if we stay only on doing active data on sentinel population, it will not be easy to have the overview data of the country and to set up, let's say, a planning and the monitoring programs. We also have to improve access to treatment, and because the expansion of access to affordable and accessible testing is a key of elimination. We also have to address transmission risk, because blood bank now are testing, most of them are testing for hepatitis, hepatitis C, hepatitis B, even HIV. But there are some, let's say, ongoing transmission that are present in the, let's say, hemodialysis, some clinics where people are not aware about that, because as I was saying, we have conducted a study on hemodialysis people, but all of them most elderly people, and we found more than 30% prevalence. This means that this is an area where new transmission are ongoing. And the public awareness campaign have to be conducted, because populations or policymakers of all those people involved in the fight against hepatitis have to, let's say, to be involved in all these activities. And the last but not the least is the political commitment. We are speaking about that since this morning, that if we put all this strategy and there is no commitment or political will, all of what we are doing will not be successful. So, to conclude, I will say that elimination of HCPs as a public health is feasible in Sub-Saharan Africa, but there is a need of immediate and sustained action. For example, to have key data, which will help us to plan what we have to do, to, let's say, identify gap in preventions, to scale up testing and treatment, and to increase access to simplify diagnostics tool, and finally to how to see how to sustain finance, for example, towards universal health coverage. And with this all, I think that by addressing this challenge, we will build, let's say, and building on existing effects, Sub-Saharan Africa will be able to achieve the global goal of hepatitis C eliminations. So thank you very much.